going to be Alexandria Albers. And Alexandria has been working at All Nations with her site mentor, Elizabeth Williams, who is the cultural epidemiologist at All Nations Health Center. Alexandria's presentation is called Evaluation of All Nations Health Center's COVID-19 Support Program. And welcome, Alexandria.
Turn my volume here. So yeah, as Lee said, I'm going to talk to you today a little bit about this evaluation that I completed with All Nations. And I just want to start with giving just kind of a high level overview of All Nations Health Center, which is here in Missoula. So All Nations is an urban Indian health center, and it serves individuals from 11 Montana tribes and tribes outside of Montana, as well as non-natives living in Missoula and Ravalli County. And they offer a variety of services, but the one I'll be focusing on today is the COVID-19 support program. So the COVID support program was initiated in response to a community need for assistance during quarantine and isolation, especially as those cases really surged in fall of 2020. And the objective of the program was to reduce the transmission of COVID-19 among Indigenous community members. And then the really important piece that I want to focus on here is this underlined portion is through support to individuals in quarantine and isolation. That's really what we focused on in the evaluation. And the support came through items that were delivered, which included cultural and traditional items like smudge or medicinal tea, food boxes, gift cards, and other items like baby formula or maybe hand sanitizer. So we decided to do a program evaluation of the support program, and we wanted to know, is the program meeting their objective? And we evaluated using a survey that could be taken either over the phone or online. And because this was not considered human subjects research, it was exempt from review from UMIRB. And the survey itself I was able to get a list of clients that had utilized the program. And so I called 108 clients. I was able to talk to 65 of them, and 34 actually ended up completing the survey. 23 online surveys and 11 were done over the phone. And so before I jump into results, I just want to give an overview of how I'm going to be presenting today. So first off, I'll go through some survey results from our multiple choice questions in the survey, which looked at requesting items and receiving items. But then we also had quite a few open-ended questions dispersed throughout the survey that I also want to present these really rich data that we found. And then overall, everything is really focused on understanding what quarantine and isolation looked like for these community members from support from this program. So just to start with demographics, so I think this just gives a really nice picture of not only who is answering the survey, but also who the program is reaching in the community. And so here on the left, this kind of block is the number of people in each age range living in households across all respondents. So this was, again, this is the ages of people in the households of the people we surveyed. So 55 years and older, mostly were 18 to 54 years in households, 11 to 17 years old, about 18 of those, and then 0 to 10 years living in households of these respondents. And then when we asked, how would you best describe yourself, about 94% said they were either American Indian or Alaskan Native alone, or American Indian or Alaska Native and at least one additional race or ethnicity. And then, so first we wanted to get an overview of what clients were requesting and receiving from the program. And so we focused on the three main items, so cultural and traditional, food boxes, and then Visa gift cards was another main item. And as you can see, a lot of clients received many of these major items, and then probably, most of the clients actually received all of these major items. So then we wanted to know, okay, well, how easy was it for you to request support from this program? And overwhelmingly, both of these results are very positive. So very or somewhat easy. Over 90% agreed that it was just really easy to request support from the program. And then on the right here, if we look at how was your experience receiving support from this program, again, overwhelmingly positive, 97% said they had an excellent or a good experience receiving support. And then when we, directly ask, okay, so did the COVID support program make quarantine or isolation easier, about the same, or more difficult for you? And we did preface this with, we know it's not easy ever, but yeah, how did the program help? And so again, very positive, 88% said easier, 2 said about the same, but nobody said that it made it more difficult to receive these items or receiving them. So that was really great for us to hear. So now I want to shift from the multiple choice questions over to these open-ended questions that we asked about receiving items and some themes that we found. So we asked these 3 kind of big questions is how we started the open-ended. So what did receiving each of these items mean for your household? And so if we first look at what did receiving cultural or traditional items mean for your household, this is a really nice representative quote, I think, of the types of answers we were hearing. So smudge, they were able to boil cedar, medicine my family has used for hundreds of years, and then traditional knowledge and practices. So multiple community members expressed that it was really beneficial to receive these items that weren't necessarily Western medicine, and really help nurture their traditional practices and get them back to healthy, or their family healthy. And we also heard that this was a really important piece to individual spirituality and how connected that was to getting individuals through those 2 weeks as well. So just a lot of really, really great feedback on this question. And then when we asked, what did receiving food mean for your household? Of course, it meant, actually getting food, but the answers we received were a little, bigger than that. So I highlighted this how to get food piece, because so many of the answers said, we weren't planning on getting COVID, and we hadn't, had enough groceries in our house when we got sick. We were worried about how our families were going to be able to get food into the house. So this was a really timely and helpful item of support for individuals from the program, was to get food boxes. And then what did receiving gift cards mean for your household? So there was quite a variety in answers for this one, but I wanted to highlight this part. So a decrease in money, and then this quote shows that they paid their utilities with the gift cards. And so we did hear this a couple times. And so just to remind you, these are Visa gift cards, because so they could do things like pay for utilities. But families were either using for utilities. Some families said, we just wanted to be able to get hot food delivered for our children because we didn't have that ability to cook for them. So a lot of different areas that this gift card is reaching in households. And then there are these 3 main themes that I wanted to make sure that I brought up and talked about today. So this kind of came from the overall open-ended question data. So support, connection, and then decrease stress or decrease in stress. And so this first quote, it was really beautiful to have support come in a really tangible way. Someone meeting someone where they're at. I felt cared for in a rough time. And then connection. So a connection to healing and community while we were in isolation. And then the second quote, you could probably argue could be maybe in other areas, but I really wanted to highlight the connection piece of, it meant being seen as an Indigenous family with needs beyond quarantine and cough drops. So that just that, connection to who you feel as a community member, and seen as that, and how that really affects your health and your health trajectory getting through this stressful period. And then the last one, decrease stress. So this one really came out when we asked about, what does the program really mean for you in general to have this support? And we heard from multiple people saying, it's just a really stressful time, and it really helped ease some of this stress, kind of regardless of what the specific stressors were, just overall helped with that. So in summary, if we look at what we found out from the multiple choice questions in the survey, COVID support program. It was easy to request support. Items were really helpful during quarantine or isolation, and overall it seemed to make quarantine or isolation easier. And then just to remind us, the objective of the program is here on the right. And I just wanted to reiterate that we're really trying to look at that support to individuals in quarantine or isolation piece. And then if we look at the open-ended question data, again, the objective shifted to the left here. We also saw it in what individuals were saying. So it helped them adhere to quarantine requirements. And then it definitely helped us get through our quarantine. So from an evaluation perspective, to really ask, like, is the program meeting the objective? I would say absolutely. The program is meeting their objective to reduce the transmission through support that they're providing to individuals in quarantine or isolation. And so thank you, and I'll take any questions that anybody has.
Thanks, Alexandria. That was great. Does anybody have a question for Alexandria right now?
Can I just jump in, Lee, and ask my question?
Yes, absolutely.
Okay, thanks, Alexandria, for your presentation, and Elizabeth, for your mentorship. I wonder two things, if you would either address one or both of them, and that's, did you learn anything about ways to improve this program if it were ever to launch again? And also, if you were to do this again, how would you change it?
Yeah, thank you for that question, Carrie. I think those actually both go hand in hand for me. Elizabeth and I really had a nice way of trying to approach that piece of it. And we decided that what was probably most important for me to provide for the program is the program is still operating. And so thinking about what's the best way to keep evaluating this program to increase health promotion long-term. So thinking about that, there were a few suggestions that I thought it maybe is a little easier to collect data as the program is going versus one time at the end. And I say that because one of the biggest barriers for me collecting data was just a lot of changed phone numbers or disconnected phone numbers. And so just making sure that those people's voices, those community members' voices are represented after they receive support would be probably my biggest suggestion. And then also actually one other one was some people wanted to take the survey, like get a text survey on their phone. So just making that more accessible.
Thank you.
Great. Thank you. Well, thank you, Alexandria, and Elizabeth too. And we're going to move to Morgan.